Brontophobia is the fear of thunder and lightning. First and foremost, a person's self-preservation instinct kicks in as they subconsciously sense the danger associated with natural phenomena such as thunderstorms. It is normal to be afraid of thunderstorms, lightning, including ball lightning, or thunder. But some people, overcome with terror, seek out a place where they cannot hear the thunder or see the lightning. Those suffering from brontophobia are constantly worried and anxious, fearing the elements. Aerophobia is the fear of flying an aircraft. Aerophobia can be either a standalone phobia or a symptom of other phobias. For example, claustrophobia, the fear of enclosed spaces, or acrophobia, the fear of heights. Aerophobia is primarily not a disease but a symptom of one. It usually manifests after the age of 25. About 15% of the adult working population may suffer from aerophobia. The main symptoms of aerophobia include nervousness several days before a flight, rapid or irregular breathing during the flight, increased heart rate, tense muscles, sweaty palms, vivid mental images of plane crashes, and an obsessive search for information in the media about plane crashes. Hodophobia, the fear of traveling. This is a phobia that can develop after widely publicized events or disasters that instill fear in society. It is the fear of being far from everything familiar, your home, city, and usual surroundings. Some people panic at the mere thought of leaving behind what gives them a sense of security, even for a short time. Trypanophobia is the fear of injections, needles, and syringes. At least 27% of American adults and 5% of adults in post-Soviet countries suffer from trypanophobia. The main cause of trypanophobia is the poor quality of medical care. Trypanophobia manifests in several forms: fear of the sight of a needle or of it lightly touching the skin. Associative trypanophobia results from intimidation by parents, their fear of injections, or a person's unpleasant childhood memories of injections. Trypanophobia can also stem from a fear of pain. Hemophobia is the fear of bleeding, blood transfusions, bloody wounds, blood loss, the sight of blood, and blood pressure. Hemophobia is one of the 30 most common phobias and most often develops in childhood. Some people do not acknowledge their fear of blood in its various forms, but when confronted with the sight of their own or someone else's blood, they may close their eyes, recoil, or even faint. Ablutophobia is a constant, irrational, obsessive fear of bathing, washing, or cleaning. Ablutophobia is more common in children and women than in men. It includes a fear of bathrooms and toilets. The Russian king Frederick the Great was so afraid of water that he was completely unable to wash his face. His servants had to wipe him down with dry towels. Autophobia is the fear of loneliness. According to statistics, the fear of loneliness is one of the most common fears among people. The desire to be loved and to have close people around is normal. It is part of our nature. However, sometimes the fear of being alone can be terrifying, and this condition is called autophobia. Usually, this feeling arises when a person is alone and constantly tries to keep themselves occupied, but often to no avail. Psychotherapy attributes this to a lack of emotional and physical connection with parents, especially during childhood. In other words, the presence of psychological trauma. Social phobia is a social anxiety disorder. It involves pronounced, excessive fear or anxiety that consistently arises in one or more situations. For example, during a conversation, when in the public eye, such as while eating, or when speaking in public, such as delivering a speech. A person suffering from social phobia fears that their actions or expressions of anxiety will be negatively judged by others and, as a result, strives to avoid situations in which fear or anxiety arises. A person with social anxiety may realize that their fears of social interaction are excessive or unfounded, but this does not make it any easier to overcome them. In most cases, social anxiety disorder begins to manifest at an early age. 50% of those affected notice symptoms before the age of 11, and 80% before the age of 20. Because the condition begins so early, comorbid disorders may also develop, such as depression or substance abuse. Logophobia is a fear of speech associated with logoneurosis, stuttering, and mutism, or a fear of speaking in general or with strangers. A fear of public speaking and stage fright with stuttering, or a fear of specific words. The phobia may be partial, in which case it is called selective mutism. For example, a person with logophobia speaks freely with a close friend, experiences logoneurosis with someone less close, and cannot speak with strangers, avoiding them and any responsibilities requiring verbal contact with them. Claustrophobia, the fear of enclosed or confined spaces. Along with agoraphobia, it is considered one of the most common pathological fears. As a rule, anxiety arises when a person is in a room, especially if it is small or has few windows. They prefer to keep doors open at all times and stay close to the exit. As a rule, people with claustrophobia avoid elevators and use the stairs. They also try to avoid large and crowded crowded crowds. Claustrophobia may be caused by psychological trauma experienced during childhood or in dangerous situations such as a fire. Acrophobia, an obsessive fear of heights. When at a height, a person with acrophobia experiences nausea and dizziness. Dizziness at high altitudes is a normal physiological reaction. In acrophobes, it develops into a phobia when fear arises even at low heights and in the absence of any risk of falling. At great heights, people with acrophobia may experience a panic attack and be unable to descend on their own. On average, 2 to 5% of people suffer from acrophobia. Among them, women are typically twice as likely to be affected as men. Cynophobia is an irrational fear of dogs. Cynophobia can develop in people who have been bitten by a dog or who have experienced severe stress caused by a dog. About 1 in 50 people suffer from cynophobia. In children, the fear may arise simply from seeing a large dog or from frequent warnings from parents about dangerous dogs. There may also be a genetic predisposition to cynophobia. Arachnophobia, the fear of arachnids, is one of the most common phobias. For some people, it is not the spider itself, but the image of a spider that causes much greater fear. There is a theory that the danger posed by certain types of arachnids may have contributed to the development of an arachnophobic response as part of human evolutionary development. There have also been reports of cases where preschool-aged children could casually touch very large spiders without feeling any fear and even considered they find them cute. However, most people with arachnophobia do not find spiders cute at all. Mysophobia is the fear of contamination or infection. It involves a desire to avoid contact with surrounding objects and constant hand washing. It is also known as germophobia, the fear of germs. This is because the fear of contact with objects is often driven by the fear of germs on their surfaces getting onto one's hands. Some famous people have suffered or are suffering from similar disorders, including Friedrich Nietzsche, Nikola Tesla, Arthur Schopenhauer, Vladimir Mayakovsky, Donald Trump, and Cameron Diaz. Herpetophobia is the fear of reptiles, specifically lizards and snakes. Cases of this phobia are quite common. The intensity of fear can vary significantly among people suffering from herpetophobia. At the sight of a snake, one person may feel mild discomfort while another, finding themselves in a similar situation, may experience a panic-stricken fear that completely paralyzes them. Hylophobia is an irrational fear of trees and forests. Literally, it is a fear of the forest. As a rule, hylophobia occurs in people who have been attacked in the forest or seriously injured by a wooden object. People suffering from gylophobia experience fear at the sight of forests. Even the sight of parks and public gardens can trigger phobic reactions in them. The fear of getting lost in the woods is also considered a form of gylophobia. Agoraphobia is the fear of crowds that may require unexpected actions. It is an unconscious fear experienced when walking alone through a large open space or down a deserted street. This phobia can develop in real life due to a fear of situations involving people or emotional trauma caused by others. Typically, anxiety is triggered by the following situations: crowds, public places, public transportation, open, deserted spaces, fields, parks, as well as places that cannot be quickly left without drawing attention from others, such as a barber's chair, center seats in a movie theater, and similar settings. This anxiety is usually triggered by the fear of public humiliation in the event of a panic attack or helpless behavior in public. Hydrophobia. Hydrophobia or aquaphobia is the fear of drowning. It involves a fear of bathing, entering the water, and swimming. Hydrophobia is very common among those who cannot swim, at the sight of or while in a river, sea, or ocean. Among those suffering from this phobia are Natalie Wood, Michelle Pfeiffer, Carmen Electra, and Winona Ryder. Natalie Wood suffered from aquaphobia and drowned off the coast of Santa Catalina Island in California. Iatrophobia is the fear of doctors or medical staff, as well as those who wear medical uniforms: dentists, pharmacists, midwives, and nurses. People suffering from this phobia avoid visiting doctors and, in severe cases, refuse to have blood drawn, have their blood pressure checked, or take medication. In such cases, another phobia may develop: chemophobia, which is characterized by a fear of taking any synthetic or chemical substance. Nyctophobia, the fear of darkness and night, the fear of entering a dark room or staying in it even for a short time, the inability to walk down an unlit street or park path, and so on. In reality, such fear is not a fear of darkness per se. The person fears what might be hiding or happening in the dark, imagines these scenarios, and they become almost real to them. In addition, a fear of the dark can be triggered by negative experiences we had as children in a dark room, on the street at night, and so on.